Listens Live.
And it is a celebration.
With your host, John Ramsey.
And welcome to a very special Thursday edition of Wave 3 Listens Live. We are live and on location. I love when we have shows like this. Get to meet some nice people, and we can take care of some of what may be your challenges. In this case, we are at the Corydon Pain Management Clinic here in Corydon, Indiana. And if you've lived with discomfort, chronic pain your entire life, there is an answer. And a lot of it involves education and a very proactive approach that they have here at the Corydon Pain Management Clinic. With me now is Dr. Elmer Dunbar. Dr. Dunbar, welcome back.
Well, thank you, John.
So glad that you're here. And Dr. Renee Tornatore. Dr. Tornatore, welcome back.
Thank you so much.
All right, so let's delve right in here. I know this sounds very basic, but pain management. Okay, so what is pain management, Dr. Dunbar?
Pain management is the management of pain. And as an anesthesiologist, I'm board certified in both anesthesiology and in pain management. We take care of people with acute and chronic pain. My anesthesia days, I took care of women in labor with epidural infusions. Now, in pain management, we're doing medical management, we're doing injection therapy, we're doing surgical intervention, and we're doing a lot of referrals here into chiropractic referrals and treatment.
Okay. I know this is a rather broad question, but I'll ask you, Dr. Tornatore, is because you articulated this well. You and I have had a little chat here, and I was saying, what really separates what you do here at the Corydon Pain Management Clinic and other pain centers? What makes you different?
I would say how we integrate the care. It's needed. Pain management is needed, and we're going to talk about the science of that in a last section, and then also the conservative care and how that helps in the science of chronic pain, and incorporating those two and doing it timely with high communication is important on patient outcomes.
Yeah, we're going to talk a little bit later on about some of the truths and some of the myths involved with pain management care. We'll talk a little bit about opioids. I like the fact here at Corydon Pain Management Clinic, very open to discussing some issues that are in the news of late. Before we delve into that in future segments, I want to ask you, Dr. Dunbar, who is a typical patient? I know we're going to meet a patient of yours here shortly in the second segment, but who's a typical patient?
A typical patient is somebody that maybe got injured a year or two ago, and they should have healed up, but they didn't, and they continue to have pain. They failed other modalities of treatment, including medical management, physical therapy. Some of them have already had surgery, and they continue to have pain, and that's what we do. We try to figure out what's going on and treat them in a way that gives them respect and gives them a better lifestyle and an ability to sleep at night and to function in the daytime.
Is this what inspired you? I think, first of all, to get into the medical field, period, I think you have to have compassion for people, and I think that is important. Obviously, both of you, your resumes, I mean, it's amazing what you've accomplished, but pain management care, this has to be, Dr. Tornatore, I would think, very rewarding work. When you can help someone who's been struggling with these challenges of pain, tell me about that, about that goal.
It is rewarding because most of them are almost in a state of despair whenever they come here. And when we start changing the way that they're perceiving their pain, it's impactful to them. We're not just trying to opioid them up. They understand that we're really trying to get to the source of the problem. We evaluate all of their medical records. We independently assess them ourselves based on a kind of a global look instead of just an isolated look at the elbow or knee or low back.
I'm curious now, when do you start dealing with the patient? Is it like, let's say, for instance, if someone's going to have back surgery or hip replacement, should they come to you prior to surgery, during the rehab of surgery, or does it depend on what happens with a future outcome?
All of our patients are referred to us by other physicians. We don't take patients that just walk in here. We're not a pill mill. You have to have a reservation, you have to have a referral, and then we put everything together that way. We want the notes from the previous treating physician, and we want to get as much information as we can and do our physical examination, complete from head to toe, and also the history so that we can understand the patient better, what makes them tick, and how are we going to interface with them and their family and get them better.
I like that because, you know, if you're a family member of someone who's suffered with chronic pain, then you're definitely directly involved. I think that's important. And I think it's also important that you have options here. Dr. Tornatore, tell me a little bit about the options. And sometimes these work in tandem, don't they? It may not be all of just this kind of treatment. It may be a combination, correct?
Yes, for sure. Well, the first thing we start them on day one is something called an ActiPatch. And it generates a frequency so high that inhibits the pain pathway. We'll talk about that shortly. And patients love that. They're getting something to do right away. We explain why high opioids aren't the primary line of defense against these problems. And then they start conservative care, whatever that entails for them, because everyone's problem is a little different. We start them on some self-care and ideas for in-between breakthrough pain. Instead of taking more medication, here's some alternatives.
Because my knowledge is elementary, okay, if I get a little basic here, you don't go over my head too much here, Dr. Dunbar, if you would.
Yes, sir.
Okay, so I use the analogy or the cliche of you don't want a Band-Aid, you want something that you can live with. You want a new lifestyle. You want to put the pain in the rearview mirror, right?
Correct.
Okay, but how would you articulate that?
The buck stops here.
There we go. I like it. Another cliche. Here we go.
Yeah, right. And we have to be able to figure out and understand what's going on with the patient and change it and change the neural pathways. And we do that with everything under the sun. My parting words to most of, if not all of my patients when I leave the room after examining them, I say, I'll get you better. I don't know when, I don't know how, but we will fight and get you better. We're not going to give up on this.
That's right. I think it's important to point out there's no miracles. It doesn't happen overnight, but there is an answer. And you can find that here at the Corydon Pain Management Clinic. Dr. Tornatore, before we go to the next segment here, I want to make it evident because you and I, and of course Dr. Dunbar, I've come to know your practice a little bit, but for those who are watching you for the first time, a little bit about your background, because I think it's important because you two complement each other very well.
Of course, like you said, of course I got into this field of chiropractic to help people. And but the real message is that it's not just diet and exercise. The real message is you have to care for your structure. And a lot of people want to do that way too late. So Dr. Dunbar's here to help once they've already destroyed their structure. We're here to mind people to take care of the structure they have. And I'll probably be dead, but someday people will get that.
I understand that. So, but education is a lot of the process here, which I like. There's options, there's education, and it's funny if something's happened to you or a loved one, suddenly you become much more medically aware. You know, you talk to doctors, you're interested because you have skin in the game, so to speak. And education to you, you want that. It's like ask me questions. You want to know what's happening to your body, and you're open to that, right?
Yes.
Okay, I love hearing that. You and Dr. Tornatore. All right, so we're going to take a little break, and coming up here in the next segment, we're going to talk to Jason, who is a patient here. If you know anyone who's had back issues, then perhaps you can relate to Jason. Some of this will definitely resonate. So hang with us. Meet you on the other side. Again, we are live and on location at the Corydon Pain Management Clinic, and we'll be back after these.